Do you get hip pain when sitting for a long period of time? For example, traveling in a car or on an airplane, or eating out at a restaurant and sitting in a booth, or maybe working at a desk, or perhaps just sitting on the couch or the recliner at home. If you'd like to learn how to sit longer with less hip pain and stiffness when you go to get up, then this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain 3 very common types of hip pain that people get when they're sitting. Now, it is very important to determine which one you have, because when patients tell me they have hip pain when they're sitting, it usually falls into one of these 3 categories, and the treatment for each is very different. So the first type is pain on the back of the hip or the buttock. Number 2 is pain on the outside of the hip. And number 3 is pain in the front of the hip or the groin. So comment 1 below if you have back of the hip pain, 2 if you have side of the hip pain, and 3 if you have pain in the front of the hip. So let's start out with the pain in the back of the hip or the buttock. And the funny thing about that is that back of the hip pain when you're sitting is usually not caused by a hip problem itself. The most common cause of pain in the back of the hip is actually coming from your lower back. Now, traditionally, people thought that back pain or buttock pain when you're sitting for long periods comes from a slouched seated posture due to herniated discs. And while that is a case in some people, particularly younger, taller people who have had a back injury, when you get to be over the age of 40 or 50, it becomes much more common that degenerated or shrunken discs in your back are the cause of back pain when sitting. When you're sitting for a long period of time, particularly if you're sitting without back support or you're focusing on sitting with good posture, it puts a lot of arch in your lower back. And when you arch your lower back, that narrows the spaces between the joints. And the joints in your lower back can actually refer pain down into the back of your hip or your buttock. Additionally, when you sit up tall with an arched back, particularly without back support, it narrows the spaces where the nerves to your legs come out. And so you can also start to put pressure on those nerves. Now, a third issue is that when you sit up tall and you use no back support, you have to use your hip flexors or iliopsoas muscles to help hold you up. Now, typically when you're sitting, those muscles should be relaxed because your hips are in a bent or flexed position. But when you're using them as postural muscles, they attach to your lower back and can actually create more compression on your spine, which equates to more pain in the back of your hip or the buttock when you're sitting. So to be able to sit longer with less pain in the back of the hip, it's really important to use the backrest on your chair. You want to make sure you're sat all the way up against the backrest where your lower back is pressed flat into the backrest. Now, if you can't reach the floor, it may help to have a little step stool that you can put your feet up on, and that helps bring your knees up a little bit higher. As your knees come up, it flattens your lower back out a little bit more and presses it more into the back, and it opens up the spaces between the joints and also opens up the spaces where the nerves to your legs come out of your lower back, and it can help you sit for longer periods of time. So that's the front to back problem if you have back of the hip pain when you're sitting. Now, additionally, if you tend to lean over to one side, if you tend to sit with your weight more on one hip than the other, or if you tend to lean on one armrest of a couch or an armchair, you may start to develop side-to-side asymmetries in your back. And when you're sitting more on one hip than the other, for one, it puts pressure right on the buttock muscle of the side that you're leaning over towards. So you can get a local compression of your sciatic nerve. You can get compression of the muscles just from the pressure of sitting with your hip bone over top of them. Or it also narrows the spaces where the nerves come out on this opposite side of the back. So regardless of which of those it is, it's best to sit with equal weight distributed between each leg. Now, sometimes you may want to cross one leg over the other, or cross the other leg over the other, and that's okay. You don't have to sit like this all the time, but try to make it pretty symmetrical to where you sit one way for a while and then another way. Don't consistently cross the same way. Now, while we're on this topic, Sitting like this and doing a figure 4 stretch, or they call it sometimes a piriformis stretch, is a good way to help with back of the hip pain. It stretches out the hip rotator muscles, one of which is the piriformis in the back of the hip. It also can stretch out your inner thigh and groin muscles. And additionally, when you push this down, it kind of opens up the space on this side of the back. So for that reason, doing a stretch where you cross one ankle over the opposite knee, and then just put a slight pressure down on the knee, just to the level that you're comfortable, is a good way to help relieve pain when you are sitting, particularly if you get that pain in the back of the hip. Now, it is important when you sit with your leg crossed that you sit with it like this and that you don't sit with it like this, because that can cause the second problem, pain on the outer side of the hip. That's most common in women because women have wider pelvises than men. And additionally, women are often taught to sit with their knees together or their leg crossed over like this so people can't see up their skirt. But when you combine those two things, a wider pelvis and then crossing across this way, it stretches all the tissues on the outer side of the hip tightly over the outside of the hip bone. For example, the tendons of your gluteal muscles, the IT band, and the bursa. And all of those things can create pain on the outside of your hip when you're sitting. So the easiest tip if you have pain on the outside of the hip when you're sitting is just to sit with your knees, feet, and hips all in alignment like that. Now, for some people, you may even need to turn out a little bit more than that. For example, if you tend to stand with your toes turned out, it's very likely that your hips are slightly turned out naturally, and so you want to give them that same turnout position when you're sitting. If you do have to cross your legs, crossing at the ankles can give you that hip external rotation where your knees aren't pushed together and you're not stretching things over the outsides of the hip. Now, there are certain circumstances for women where it may not be appropriate to sit like this, but largely if you're wearing pants or you're working at a desk or you're eating with your legs under a dinner table or you're just sitting at home and there's no one else around, it's perfectly fine to keep your legs a little bit wider apart so that you don't stretch the muscles over the outside of your hips. So that's the second problem. Now, crossing your leg like this can also lead to the third problem, which is groin pain or pain in the front of the hip. Your hip joint is a ball and socket joint, and it's most narrow when you bring the knee up, internally rotate the hip, and then cross it over or adduct that way. So that's the maximum impingement position where you'll tend to pinch things inside the groin. And that can be a problem, particularly if you have hip arthritis or some other pathology going on inside the hip joint. So you want to avoid sitting with your hips in an internally rotated position like this, and also sitting with your knees crossed like this. Both of those narrow the hip space. Now, additionally, remember we talked about before, if you sit up like this, that tilts your pelvis forward and it narrows the spaces between the pelvis and the hip. So you want to avoid sitting with that forward tilt of your pelvis. Additionally, if you've got really bad hip arthritis, you may have trouble even sitting at a 90-degree angle. So in that case, you may actually have to slouch down a little bit in the chair. Put something like a pillow back here to give you adequate back support. This opens up the hip joints where you've got a greater than 90-degree angle, and that way you aren't as likely to pinch. Additionally, turning your hips out with the ankles crossed like this, like we mentioned before, can also help open up the space in the hip joint. So if you have front of the hip pain, you want to have less flexion, more of an open angle like that, less internal rotation, sitting like that, and then knees wider, so not having them adducted or legs crossed like that. Now, when you go to get back up, regardless of what type of hip pain you have, you want to use sort of a hip hinging technique. And so to see that from the side, you'll scoot to the front part of your chair, bring your feet underneath of you, and then lean forwards like this to get your weight loaded over top of your feet. Then push your hips back underneath of you like that. Now, if you have front of the hip pain or hip arthritis, you may have a little bit of difficulty bending forwards like that. And that can complicate the situation a little bit because you get more leverage when you lean forwards, but if you have pain in the front of your hip and you can't lean forwards, it's a little harder to do that. So some options are, one, to spread your legs a little wider and externally rotate some. That gives you a little bit more clearance to where you can flex down a little bit better with your knees wide and come up like that. Now, if it's gotten really, really bad, you may have to use your hands some. That might be the only option. So getting as much bend in your hips with your knees wide as you can, and then using the legs to kind of help you get up the rest of the way. So those were the tips to sit longer with less hip pain. Hopefully you did find those helpful. If you are in the St. Louis area and you need more help for hip pain, we'd be happy to help you out here at More for Life. And no matter where you're watching this from, if you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.